What is blepharitis? Blepharitis is one of the most common conditions that we see in our office. It causes irritation and a greasy sensation in the eye and the eyelids. Sometimes it feels like there is something in the eye, but it's mostly described as irritation. The reason for that is the blockage of the meibomian glands on the margins of the lids. The margins of your lids are lined by the openings of meibomian glands that go along the lid, and their opening is very near the base of the eyelashes. When this opening gets blocked, bacteria and fatty secretions accumulate together and cause irritation and inflammation, and they prevent from the secretions of the meibomian glands from reaching the eye and cause irritation. They cause the eye to become drier, and they cause the lid to become irritated. You can think of the lids as the wipers. If the eye surface, if the cornea and the conjunctiva, the surface of the eye, are the windshield, the lids are the windshield wipers, and their function is to spread the tear film along the surface of the eye. And when they cannot do that adequately, you feel it. You feel that the eye is irritated, and it feels that almost there is something in the eye. So the first step in the treatment is to use a hypochlorous acid solution that you can put on pads and apply your eyelashes. Make sure that apply mild to moderate pressure when the eyes are closed to the base of the lashes in order to clean the material out. You can also use warm compresses. There are special gel pads that are good for that purpose. And you need to do that once or twice a day. And if it doesn't get better after a few days, we go to phase 2. In phase 2, you need to see your doctor. And they can either prescribe an antibiotic-steroid combination, or even better, they can do what's called a meibomian gland expression. One of my doctors in the office does that really well when she squeezes the meibomian glands, which are basically go deep into the lids, and she expresses the fluid out and she cleans it up. And that causes the patients to feel a lot better immediately. You need to remember that blepharitis is a chronic condition. So this is not something you're going to cure with one treatment. This is something that you need to take care of by cleaning your lids and following a lid hygiene regimen. If all else fails, an oral doxycycline pill taken once a day could be helpful, but it doesn't work immediately. It takes a few weeks for it to start working. Another option is a procedure called LipiFlow, which is a process with a special device that applies heat to the eyelid while at the same time squeezing it, and heating the fat and squeezing it out helps clean those eyelids. So another thing to keep in mind is that if you have a significant amount of itching with the blepharitis, you may have a condition, an infection with a special parasite called the Demodex. And these parasites basically line the length of your lashes and cause irritation and itching. Unfortunately, regular antibiotics are not effective against them. And one of the things that you need to do is basically physically remove them. You can do it by applying a solution that has an oil-free solution, applying it to your eyelashes, or your doctor can do it in the office. There's a new drop in development specifically for the treatment of Demodex, but it is not FDA approved yet. So stay tuned.